Hi, I'm Sharon Miller, Purdue's Assistant Vice Provost in Indianapolis. I'm also an Associate Professor of Engineering Practice in the Weldon School for Biomedical Engineering. As an engineering professor of practice in biomedical engineering, my research background is more on the educational space. So a lot of the things I do in my work involve curricular interventions and developing assignments and pedagogies that we can implement throughout the biomedical engineering program for undergraduate students here at Purdue University. And some of the curricular interventions that we implement include design tactics or design techniques. So a lot of times when students are in the classroom and we're trying to give them the workforce skills for them to become proficient biomedical engineers, they definitely need to understand how design works and how to become proficient at designing, but they also need to consider other things like needs finding and clinical immersion pieces, so understanding how the medical profession works and our medical collaborators are needing some of their areas of expertise. So curricular areas of focus that we work on include BME design. We also look at health equity throughout the design process and throughout the undergraduate curriculum. And we look at needs finding and clinical experiences. So a lot of times what our research group is doing is essentially designing interventions that we can instill throughout the undergraduate program in biomedical engineering and study if those actual assignments and things that the students are charged and challenged to do are effective in helping them become more confident in their design skills or their tinkering skills or their experimental design skills. And so some of the areas of research that we really dig into are design self-efficacy, because efficacy is sometimes an inferred skill. So when you're in the workforce or in the classroom, students don't necessarily develop those skills naturally. So we have to design curricular pieces to challenge them and to help them become more confident in how they can do that. So a lot of the times we are coming up with ways that we can put design projects within biomechanics labs or bioinstrumentation labs or biomaterials labs so that when they do get to capstone or other high impact practices like experiential education or internships that they're going on, that they are equipped with a higher sense of design, self-efficacy, and confidence. So that's part of what we do. I think another piece that's really important to highlight for what we do includes clinical immersion. And so clinical immersion is an experience that we can provide students so that they can understand more acutely sort of what skills they can bring as biomedical engineers to understand and unravel some of the systemic healthcare problems that we have in our state, in our city, in our nation, so that we can develop better medical technologies for them to hit the market and really help people. And so we help them understand the different facets of the healthcare system by giving them opportunity to jump into experiences within the hospitals in Indiana, Indianapolis, and then some. So not all students want to go into the clinic. Some students want to go into industry or are med school or pre-professional bound. So giving them an opportunity to understand clinical immersion and what that can provide them, not only as a biomedical engineer, but how they can take that and really amplify whatever experience, academic, industrial, or nonprofit after they leave to affect and really be a better designer. And so, instilled in a lot of the clinical immersion experiences is, we look for projects that help students understand universal design and being able to identify some of those pieces more readily and more easily. And so we have a summer clinical immersion program that we offer students that are undergraduates to join us. And throughout that project and throughout that time, the students they get immersed into the hospitals and different disciplines. But from the research side, what we're doing is really helping them hone in on their critical reflection skills. And so we study how the immersion experience really affects their ability to become a more confident engineer, to unravel some of the pieces about the design process that's specific to complex biomedical engineering problems, so that we're building them, to really be students that can solve hard problems in the medical innovation spaces. So we also monitor their self-efficacy. So we, linking it back to not just in the curriculum, but we look for experiences that are clinical or medical in nature so that we can see if those experiences are also amplifying students' ability to have increased self-efficacy when they're designing, because that's a very important thing for them to carry forward in the workforce. Being part of the Purdue family in Indianapolis brings an excitement to understand, or to help others really understand some of the opportunities that we have within our city. And so from a biomedical engineering perspective, when I'm thinking about being, a professor in my classroom and designing great experiences for biomedical engineering students, being in Indy and being under the Purdue umbrella really amplifies the ability for me to go out and get great projects and make great connections to the folks that are in our medical spaces in Indianapolis. So we're fortunate enough that Indianapolis has many large hospitals that are even within walking distance of our educational spaces. So in the city, I can take my students across the street and we can explore together and make those connections with the medical professionals that are in the city. Beyond the medicine that happens in Indianapolis, I feel like being under the Purdue umbrella has really broadened it statewide, because there are so many other spaces within the state that we don't necessarily think about all the time when we're in an urban setting. And so making sure that we're bringing facets of all types of healthcare problems to the classroom so that students can recognize that there's more than one type of ecosystem that has healthcare issues. And so, being in Indianapolis is fantastic for some of those urban connections to the clinics and beyond and companies. But being part of Purdue means we have access to the entire state, so we can bring some really powerful collaborators and connections to the classroom for the students.